The rise of GLP-1 receptor agonists like Ozempic, Wegovy, and Mounjaro has ushered in a new era in weight loss treatment, one that brings both promising health benefits and unavoidable risks. Originally developed to manage type 2 diabetes, these medications have shown remarkable effectiveness in reducing body weight, curbing appetite, and improving metabolic health. For many, these drugs have offered the first meaningful success in a lifelong struggle against obesity and its dangerous complications. Yet, as their use grows well beyond clinical obesity into more general weight management, we find ourselves standing at a critical crossroads. How do we embrace the potential of this therapy without ignoring its very real consequences? When used appropriately, GLP-1 receptor agonists can deliver powerful and life-changing results. By mimicking the body's natural hormone GLP-1, they slow digestion, regulate blood sugar, and suppress hunger. This can lead to significant reductions in body weight, improvements in blood pressure, cholesterol levels, and insulin sensitivity, and even a lowered risk of heart disease and certain cancers. For patients facing life-threatening complications from obesity, these drugs can be transformative, extending lifespan, enhancing quality of life, and breaking cycles of failed diets and chronic inflammation. In these cases, the value of the medication is undeniable, but the story is more complex than clinical data alone can convey. As weight loss accelerates, sometimes 15% or more of body weight in a matter of months, new side effects are emerging. The body, in its attempt to adapt, doesn't always do so gracefully. Aesthetic changes like Ozempic face, where facial volume disappears, or Ozempic mouth and feet, marked by sagging skin and excessive wrinkling, have captured attention online. These visible effects reflect the deeper truth. Rapid fat and muscle loss does not occur without cost. The skin, accustomed to years of expansion, doesn't shrink overnight. Instead, it lags behind, leaving loose folds and pronounced lines. Still, these side effects, while real and concerning, should be kept in context. They are not inherently harmful in the way a heart attack or a liver failure might be, but they do remind us that every medical benefit comes with trade-offs. With appropriate planning and support, particularly strength training, protein-rich diets, and adequate hydration, many of the physical drawbacks of rapid weight loss can be managed or reduced. In fact, users who combine GLP-1 medications with structured exercise and nutrition plans tend to preserve more lean mass and experience fewer structural concerns. Another key factor is the permanence of the effect, or rather, the lack of it. Once the medication is discontinued, appetite often returns, and so does the weight. This is not a magic fix, but a managed state. Continued results require continued use, which introduces the question of long-term dependency. Is this a medication to be taken for a year, 5 years, a lifetime? That remains unclear. What is clear, however, is that these drugs are tools, not standalone solutions. They must be part of a broader, more holistic strategy that includes psychological support, behavior change, and lifestyle adjustments. Even as some seek cosmetic solutions to address physical side effects, like fillers or surgery, others are turning inward, rebuilding their health from the inside out. It's a shift that can empower individuals to take more control over their wellness. The focus moves from rapid thinness to sustained health. The emotional lift from reduced weight, better mobility, improved energy, and a stronger sense of self-control cannot be underestimated. In many cases, people feel not only physically lighter, but mentally freer, able to engage more fully with life, relationships, and work. At the same time, these medications demand ethical oversight. They are powerful enough to change lives, and thus powerful enough to harm. For those without medical need, using these injections casually or cosmetically risks normalizing pharmaceutical intervention as the default path to thinness. That's a dangerous message in a society already obsessed with perfection. It's essential that providers, public health officials, and the media communicate the full picture, the risks, the benefits, and the responsibilities of using such drugs wisely. GLP-1 receptor agonists offer tremendous potential, but they are not shortcuts, and they are not without cost. They work best not in isolation, but in combination with nutrition, movement, self-awareness, and professional guidance. For some, they are a key to freedom from disease. For others, they may be an invitation to pause and ask, what am I really seeking from weight loss? Is it health, confidence, control? The answers may lie beyond any prescription. With respect, caution, and the right intentions, these medications can be part of a deeply positive journey. But they must be understood for what they are, not a cure-all, not a cheat code, but a complex and demanding therapy that reshapes the body and the future in ways we are only beginning to grasp.